Hello, my name is Bowie. I use they, them pronouns. If you have never met a non-binary person, here I am. You're welcome. You probably have, but just don't know it. Today I am going to be talking to you about 3 main points. Being non-binary, growing up queer in a rural setting, woo, and also being founder of multiple LGBTQIA+ focused businesses. Press about me. So I am non-binary. That means that I don't really define myself as being within any particular gender identity. I'm kind of like a little bit over here and all the spectrum might be a bit here. So I am from regional Queensland. I don't know if many people know where that is, so I have had to draw a big circle on the map. And then zoom in a little bit. I'm from a town called Yeppoon, and it is right near a metropolitan hub known as Rockhampton. I don't know if any of you have ever heard of it. Hands up. Yeah. Oh my gosh. I have never met so many people who actually know where that is. Some positive places about it. The pineapples, the saltwater crocodiles. Like the pineapples more than the saltwater crocodiles. As well as all of the cattle statues that fill the town of Rockhampton. I don't know if you've ever driven through the main highway of it. There's about 15, I don't know what the obsession with it is, but claim to fame, that's where it stands. If that doesn't tell you about the mentality of the people that live there, I don't know what else will. It was an interesting experience growing up, being, well, visibly queer. I've never really tried to hide it, but along with that came a fair bit of hostility, judgment, and just difficulties in kind of existing in that space, just with the general population, let alone when it came to any sort of access for supports. For myself, I didn't actually feel safe to come out as non-binary until I escaped the deep north and moved to Melbourne, where I actually found, somewhat of a more open, liberally minded community. I found that Victoria on the whole seems to be a lot more progressive than Queensland. Surprise. Now, along with my journey of discovering my own identity and understanding myself, I also decided that just to complicate it a little bit more, I would also start a business supporting other people as they explore their gender identities or sexuality. That made it rather interesting, but also a really good learning experience, because as I was trying to discover who I was, I got to talk with other people who were either a little bit before my part of my journey or a little bit ahead. So I got to learn a lot about what it meant being non-binary, what it meant to express gender identity, what it meant to just exist openly and comfortably as a queer person. Yay. So I found that really beneficial, and along with that, it gave me a really great understanding, not only from my experiences of what I knew was missing when it came to supports. In Queensland there was a lot, especially when it came to accessing medical supports. Now, a lot of the doctors that I would access up there, they weren't really open when it came to talking about being queer. At the time, I was just a general, run-of-the-mill lesbian, kept it much simpler, and trying to access health supports when it came to sexual health checks and things like that. I got a lot of, you sleep with women, you don't even need an STI check. It's like, well, 2 problems. You're assuming women means vaginas, and secondly, I'm pretty sure that we should all probably be having STI checks if we're sleeping with multiple partners. And I found that really difficult. I found that it made me feel unsafe, so I didn't really want to continue accessing supports with them. However, in Yeppoon, there's not really a lot of doctors to access, so I kind of just had to suck it up and give a little bit of an education session as I went to the GP to talk about whatever needs I needed to talk about. It wasn't always bad. I sometimes got a little bit of understanding. Mostly I got kind of weirded out looks from people, and it wasn't so fun. Moving to Melbourne, so much better. I found I was able to access supports that made me feel safe, that made me feel more understood. Not all of them. I did have to do a little bit of hopping around because I guess I generally thought, city, everyone will be understanding. No, everyone is not understanding. However, there are just more people who are understanding. Now, as I've mentioned, on the whole, Victoria does seem to be more progressive. However, when it comes to regional settings, I do think that there are often a lot of barriers that overlap, regardless of what state we're all in here. We do know that, in general, people who are from the LGBTQIA+ community generally have more difficult times and lower positive health outcomes than people from the non-queer community. That may include mental health issues, physical health issues, and a lot of them are ongoing and chronic. Now, this is a big barrier, especially with the work I've done with my community. I had spent 10 years as a fitness coach, so working with a lot of queer, transgender, diverse people to help them just connect with their bodies, learn how they can transition in ways that feel good for them, and really start to connect with their bodies and who they are. And this is awesome. However, the problem with living in rural spaces is that there's not necessarily the access to those supports. I'm generalizing. Most of us probably know that across the board, there is a more hostile, less welcoming environment for people from the queer community. And this is why inclusive business is important. And from what I've talked about with people, from what I understand, there are a lot of limiting factors that will stop people from wanting to access medical supports. I know it did for me. These include when we access GPs or we access medical supports, especially if we're looking to transition and we want affirming care. It's not always easy to find that, and we're not always going to be able to have the confidence or the support to even start looking at who we can go to help us in these spaces. And it is because, in general, a lot of the medical supports that we're accessing don't really advertise that they understand people from the community. You know, a lot of people like slap a rainbow on something and be like, should be right, mate, you know, all you need is a rainbow, everyone's gonna come along. Not always the case, because the rainbow doesn't necessarily mean that you've educated your people or your staff when people from the queer community do come in, that you're actually going to be able to understand their needs. I got this a lot, especially being assumed female, especially being presumed to be living some sort of cisgendered heteronormative lifestyle. So these are really big barriers that I found difficult, and I know that they are barriers that a lot of people from my community feel difficulties with, and it actually stops them from choosing to access medical supports. They would rather live with the chronic health issues that they have them unaddressed and suffer through that, as opposed to having to go and talk to a general practitioner or someone for affirming supports and actually get the help they need, because they are scared that they are going to be misgendered, that they're not going to be heard, that their experiences are going to be dismissed. And this is a huge problem. And this is why spaces that can openly say, yeah, we've stuck a rainbow in a window, but also we've taken the time to talk to our staff, we've given them an understanding of what pronouns are. We're not going to assume that just because you present as female that you're heteronormative or that you're cisgendered or anything of that nature that really becomes a limiting factor. And my businesses are not necessarily in the medical way, but I've definitely spent a lot of years working with people with their bodies and getting that understanding of what is important for them and how to help them feel good about who they are. And this nice little graph right here pretty much gives you a breakdown of all the good things that can help you start to take the steps to become more, I don't want to say inclusive, because I feel like that's just a word that's so used to death. It's like, we're all inclusive here. Not necessarily. And I think that it is subjective. So what is important is to be able to build an understanding that it's likely that the work that you're doing, there's things you don't know, there's things you don't understand, but there is things that you can learn, and it's a very important thing to do, because in general, there is a greater need for people from the queer community. So why is it important? We face high levels of discrimination, even in Victoria, majestic Victoria. Not as bad as Queensland, but I feel like it's not really a fair comparison. Let's be honest. Queensland's like 30 years behind in progressiveness, I'm pretty sure. But We know statistically, even when it comes to like physical and mental health, 38.1% of people from the queer community have higher risk or issues with mental health, physical health, compared to the general population. This is a ridiculous statistic, and it's not the only one. There are so many, like I could list off some really horrifying statistics. None of them are great. They're all high numbers that are bad. And what this means is that we are not addressing the needs of the community in a way that actually reflects positive health outcomes for people, even if we think that we are. There are so many ways that could be access to better support people from the queer community, especially in regional and rural areas. And I'm sure you all understand, working in these spaces, that some of you might treat people from the LGBTQIA+ community. You might even find that you have like an excessively high number of them because people in the community talk. And if they realize that you are a space that actually offers safe and inclusive supports for people, they're going to tell all their friends, and their friends are going to tell all their friends, and you are going to be treating every gay in the village very soon. And that is a good thing. Good that people are finally getting the access to support that they need. Really sad that you're the only one doing it in what, like, however big of an area you might be, regardless of whether you're like a bigger commercial hub, especially out in these rural areas. And this highlights the need that we have for more accessible and better supports, because I think gone are the times where just whacking a rainbow on the window is enough to invite people in and have them actually trust you that your space is going to be safe. Now, I've talked with people from across my community, just in general, really, not like sitting down with an interview or anything like that, just trying to understand what their needs are. And I've had people tell me they would rather skip STI checks because they don't want to have to talk about their bodies. They don't want to have to show someone else their bodies. They're so ashamed of their genitals, of their chest, of these parts of their bodies, and they would rather risk whatever long-term health conditions that could occur than actually go and seek any sort of health checks or sexual health checks, because it's just too awkward, it's too uncomfortable. They don't feel safe or trust that they're going to be understood, supported, or that their needs are actually going to be addressed in a way that is good for them. And that's really sad. People who will skip mammograms because they don't want someone to have to see their chest, or they're so ashamed of it. They don't want anyone to have to talk about it, or they go to a doctor to talk about these things. And the language they use on their bodies might be different from what a GP would use, and then they feel shamed because they don't feel welcome to use whatever words that they want to use on their body with their body, and someone else is not going to believe them or take them seriously. They are infantized because the words they might use that could sound a little bit silly to you, and clinically the words you might use are correct. However, that doesn't mean that people out there are going to be comfortable using those words. And the power that those words have is huge, because it can be the difference between someone choosing to actually do something for their health or opting out and just being like, yeah, I think I'll just risk it. What could go wrong? A lot. And this is where you have the power to change that. This is why it is important. And there's actually a really good printout. I think Gov does a lot of good things. My totally unbiased opinion. They do a lot of great things, and they put out a lot of great initiatives, and they are funding a lot of supports for the LGBTQIA+ community, and they do focus on rural areas. The Pride in Our Future, there's multiple, I think there's like 3 booklets that the Victorian government has done. Really great information in there if you want to start getting an understanding of like the health outcomes and the general outcomes that people from the queer community experience and face, and maybe filling in those gaps for yourself so you can then understand how you might be able to support the people in your local community. So what can you do? We look at active inclusion versus passive inclusion. Active inclusion is actually not just saying that you're understanding, it's showing people that you're understanding. It's welcoming them in. It's actually following through on the words that you say. And instead of it just being like, oh, no, come on in, everyone's welcome here. Really, we're here for everyone. Doesn't always have the emphasis you think. That is actually passive inclusion, because what we're not doing is making a point of understanding that everyone's needs are different. Just because we have people from different communities, like the queer community, and there's a lot of intersectionalities within the queer community as well, because a lot of people from the queer community also have disabilities, also have a lot of mental health challenges. So there's a lot of overlaps here. And when we passively include someone, we're just saying, nah, your identity doesn't matter. You know, it's not important. When in fact, for some people, it is huge. It is one of the most important things about themselves, especially if they're trying to work through it. So when we passively include people, we're kind of just slapping the old rainbow on the window and, you know, leaving it at that. But when we actively include people, we say, you are welcome in our space. Look how we are showing you you are welcome in our space. Here are some images on our walls that are not cisgendered, heterosexual, able-bodied, white-centric images. There might be a little bit of diversity there. There might be some images of same-sex relationships. You know, wow. But these small things, they might not seem like much to you. They might actually, you might be sitting there going, well, where am I supposed to find those? Good question. Because they are not available. Because in general, what we are focused on across society is a cisgendered, white, heterosexual, able-bodied kind of image of life. And that is a barrier in and of itself. So when we can actively take steps, even in those small, small ways of showing people, here in our space, here is how we're inclusive. We will have images on our walls of all different people from across our community. When you come in and we talk to you, I will ask you what your pronouns are. You tell me your name. I'm not going to question why your Medicare card says a different name to what you're giving me, and then refuse to use the name that you've asked. Simple things. The paperwork that you might use when you're asking people about their personal information. You know, is it necessary to ask what their assigned sex at birth is? Sometimes yes. If it's for like private exams, you might need an idea of what's going on down there. However, there's ways we can do this respectfully. Press. How can you shape change? Now you might not be the person who runs your space, and a lot of the time that is the case, and you can have one person who's all up there, yes, everything needs to change, we need to do all the good things, and you've got enthusiasm, and then everyone in the space relies on that one person, and it's exhausting. And it becomes really difficult for shaping change when there's other people in the space who might be a little bit hesitant or not see the need. I find that people who maybe are a little bit more passively inclusive is because they don't necessarily have the understanding or experience with people in their lives who might be affected by these things. And that's a really common thing. It's like, oh, well, it doesn't affect me, so I don't know what matters. Everything seems fine. When that's not always the case. So, educating yourself, biggest part that you can do. And it all starts with language, the way we talk to ourselves, the way we talk to other people, and not just in work, but across the board. We've got to understand that our language has power, and the way we think about people, the way we think about our community, whether it's in a professional space or in a personal space, it all overflows. There's no separation there. So when we start learning, we need to start putting these things into practice, using the language that we would use at work in our everyday life, because it then becomes easier to be able to communicate with people who might use different pronouns or might have a different name. And I will say that I find people who have named themselves come up with the coolest names ever across the board. Literally, I know a person who named themselves Dragon. I was like, damn it, I wish I had thought of that before I changed my name, but it's just so expensive, so I'm just sticking with Bowie. It's fine. But respecting people and using our language to do it has so much power. That is one of the biggest places that we can start. And it doesn't have to be complicated. I think we can overcomplicate it and it can feel overwhelming. But if we just keep it simple, and it all starts with asking people questions. People will tell you how they want to be communicated to. People will tell you the language that they want used on their bodies. If you ask people questions, they will give you the answers that you can use to show them the respect that they are asking for. It's really that simple. And what if you don't know where to start? Because there is probably going to be a lot of questions, and also not necessarily, there's not like starting a queer affirming business kit 101. That is not a thing. So it can be complicated sometimes. Trying to figure out where you start. Asking your community, asking the people who access your services is a great way to start. Don't just walk up to a random person who you think looks queer and be like, wait, are you part of the queer community? My business wants to work better for you. No, not the way to do it. don't assume people because they look queer are queer. Maybe they're not. Maybe they're just someone who's just a general heterosexual person who's a little bit quirky. It's fine. We can't make these assumptions. But asking questions, getting an understanding of the people that you support, it's a great way to start. I can't emphasize enough how if you reach out to the people who you are supporting and just check in with them, you might find that you get some really amazing feedback, some really great understanding of who you're supporting, how you can support them better, and do it in a way that helps the people you're asking actually feel empowered and want to continue to access supports with you. The end.